Let's welcome Ms. Sharmila Devi, Senior Onco-Dietitian. She will be talking about the importance of maintaining a good diet, side effects, and comorbidities management during cancer treatment. Sharmila Devi has been associated with 4-Base Care since November 2020. She is a postgraduate in clinical nutrition and dietetics and certified in cancer nutrition. She is member of Indian Association of Parental and Enteral Nutrition and consulted around 1,000 patients in 4-Base Care till date. Over to you, Sharmila.
Thank you, Aditi, for the wonderful introduction. Namaste all. I am Sharmila, Senior Onco-Dietitian. I help in dietary management during cancer care. I am here with you all to discuss the importance of diet during the cancer journey. Let's begin with the presentation. Let us start with the basics. Let us first learn what is health, balanced diet, and healthy eating. Then move on to our main topics. What is health? Health is defined by the World Health Organization as the state of complete physical, mental, and social well-being, and not just only the absence of disease. The essential dimensions of health would include achievement of optimal growth and development, mental well-being, ability to combat disease, ability to withstand aging, and resisting infections. So what is balanced diet? A balanced diet is one which contains different types of foods in such quantities and proportions so that the need for calories, proteins, minerals, vitamins, and other nutrients is adequately met, and a small provision is made for extra nutrients to withstand short duration of leanness. In addition, a balanced diet should provide bioactive phytochemicals such as dietary fibers, antioxidants, and other nutraceuticals which have positive health benefits. Low glycemic index foods are much preferred in a balanced diet. A balanced diet should provide around 60 to 70% of total calories from carbohydrates, 10 to 12% from protein, and 20 to 25% of total calories from fat. Thus, a balanced diet enhances the quality of life. What is healthy eating then? Healthy eating index is a measure to assess how well a diet conforms to the recommendation of the dietary guidelines. Look at this food pyramid to understand better about this. As basis for the balanced diet, ICMR suggested food pyramid, which is self-explanatory. Healthy eating pyramid is a plan to help people choose the foods amounts that are right for them to balance with their daily physical activity. This is meant for any healthy person who is above the age of 2 years. What does this pyramid emphasize? Number one, be active. One has to do physical activity every day to be fit. Number two, vary your choices. The 6 bands stands for the 5 food groups plus an area for oils. Number 3, think in proportions. Number 4, make moderations. Number 5, customize. This pyramid is available for kids and also for vegetarians. They can be used according to a person's need. And number 6, improve gradually. Small steps add up to big benefits. So we have learned the basics of nutrition. Let us move on to the next slide to learn about the interesting topic, functional foods. Functional foods are taken as regular foods as a part of an uncommon diet and not in the form of dose, which provides physiological benefits beyond basic nutrition function. They are not pills or capsules, but a part of a normal food pattern. Food also act as antioxidants, detoxifying agent, and so on. Let's look into them a bit in detail. Antibacterial effect of food. The probiotics support intestinal health by inhibiting the overgrowth of toxic bacteria. Fermented dairy products like curds contain live cultures, which helps in preventing cancer. Antioxidant effect. Dietary antioxidants can be nutrients or non-nutrients. Dietary components identified as antioxidants are beta-carotene, vitamin A, C, E, niacin, riboflavin, and sulfur-containing amino acids. The diet should include foods rich in antioxidants, particularly fruits and vegetables, to prevent degenerative diseases. Blocking and suppressing effect of the food. There are other chemicals in foods which act by preventing potential toxic agents and carcinogens from reaching the target tissues by suppressing their action. People who consume soya foods rarely will surely experience breast, uterus, or prostate types of cancers. Anti-inflammatory effect. Monoterpenes and gingerols present in ginger have anti-inflammatory actions in musculoskeletal disorders. Detoxifying effect of the food. Foods which contain such detoxifying chemicals are cabbage, tomatoes, strawberries, pineapples, green peppers, in simple green and black teas. They activate liver detoxification enzymes and can reduce the incidence of tumors. Digestive and related effects. We all know spices in general stimulate salivation, acid secretion, and digestive enzymes. Spices are used to reduce flatulence. For example, omam or ajwain is a household remedy for indigestion. Asafoetida has a similar effect too. Fenugreek is used in buttermilk in the treatment of dysentery. Hypocholesterolemic effect. Soya protein reduces the plasma cholesterol concentration due to the presence of isoflavones. Garlic also reduces plasma LDL cholesterol, which means the bad cholesterol, and the triglyceride concentration also. Hypoglycemic effect of food. The soluble dietary fiber fractions of fenugreek seed is known for its hypoglycemic effects in humans. Beans and whole grains positively affect blood glucose management and insulin sensitivity. Immunopotentiating effect of the food. The immune response may be further enhanced when one or more probiotics are consumed together and work synergistically. Thus, food has many functions other than just being nutritive. Let us move on to the next slide now to be aware about the dietary factors that increases the risk of cancer. Foods may cause cancer by being a direct carcinogen, or carcinogens may be produced by cooking. Meat. Meat intake has been positively associated with the risk of digestive tract cancers and breast cancers. Intake of red meat such as beef, lamb, and pork and processed meat increases the risk of cancer. I have noticed that there is a question on red meat in a question and answer session. So I hope this would answer your queries. Energy balance. Physical inactivity, high energy intake, and large body mass are associated with increased risk of developing colon cancer in men and women. In breast cancer, a positive association with weight gain and increased waist-hip ratio is seen in postmenopausal women. Sugars. This question was answered by Dr. Sandeepnayak sir also. So let me give a bit more better answer for this. Consumption of simple sugars may be related to colorectal cancers, but one must always keep in mind to keep their comorbidities under control to control their disease progression also. Excessive starch foods may also predispose to gastric cancers. Fat intake. A high intake of saturated fat increases the risk of prostate cancer and may be related to colorectal cancers also. Vitamins and minerals. Deficiency of folic acid and vitamin A and C have been associated with the development of cervical cancers. Alcohol. There are studies indicating that alcohol has a casual role in carcinogenesis, especially for cancers of the mouth, throat, breast, pharynx, and esophagus. Nitrosamines that are present in tobacco and tobacco smoke. These are potent carcinogens and may cause nasopharyngeal, stomach, and colorectal cancers. Aflatoxins. The fungi which grows on cereals and groundnuts can cause liver cancers. Hope I have given a better idea about the risk factors that increases the risk of cancers when it comes to diet. Now, let us move on to the next slide to understand the evidences of the same that was discussed now. Studies from Japan, which is a low-frequency region for breast cancer, has shown that reduction in risk was associated with milk and green-yellow vegetables consumed by pre- and post-menopausal women. Traditional Japanese diet with fish were more beneficial in post-menopausal women, so did the fruit consumption also. Early life diets also influence adult onset of breast cancer. Studies from Harvard showed that adolescent consumption of eggs, vegetable fat, and fiber was associated with a lower risk when compared to women who consumed more butter. Physical inactivity, high energy intake, and obesity are associated with rectal cancer, and there is a probable synergistic effect among the three risk factors. Animal fats are not only associated with large bowel cancers, but also with the benign tumor or adenomas. According to the study conducted by scientists from Harvard Medical School, participants with a high consumption of ultra-processed food had a higher BMI, who are less likely to exercise regularly, higher rates of diabetes, had an increased risk of cancer. Hope the evidences are enough for you to prove the dietary impact on cancer. Now, let's move on to the next slide to learn on our main topic, cancer and its impact on health. Neoplastic disease is commonly associated with three basic systemic effects: anorexia, hypermetabolic state, and negative nitrogen balance, often accompanied by increased weight loss. Abnormalities in metabolism. The extreme weight loss and weakness is caused by abnormalities in glucose metabolism, in which cancer patients cannot produce glucose efficiently from carbohydrates and instead feed off their own tissue proteins and convert it to glucose instead. Anorexia. It may be often intensified by fatigue, pain, fear, depression, or can be developed due to the consequences such as treatments like surgery, radiation, and chemotherapy also. Anorexia will lead to weight loss and malnutrition. Many factors appear to play a role in wasting associated with cancer. The combined effects of poor appetite and abnormal metabolism result in lower supply of energy and nutrients as instances when the demands are high. Malabsorption. This can occur due to blind loop syndrome. The associated overgrowth of bacteria in the upper small bowel may result in steatorrhea and vitamin B12 deficiency. Fluid electrolyte imbalances. Vomiting and diarrhea not only bring losses of water, but also cause loss of water-soluble vitamins. Anemia. The underlying problem of anemia may be compounded by a number of factors, including anorexia and malabsorption of dietary nutrients. Taste and appetite changes may be due to psychosomatic factors such as fear, pain, and side effects of medications. The fear by the diagnosis of cancer and its outcome, and the stress of diagnostic procedures. Those stresses can cause learned food aversions. Hypercalcemia. This is one of the most common metabolic complications of cancer. Approximately 20 to 40% of the patients with breast, squamous, bladder, and renal carcinoma develop hypercalcemia at some point in their disease. And osteomalacia, generally like the gastrointestinal malabsorption of calcium and phosphate is observed here. Resection of the tumor actually corrects the bone disease in such cases. So we understood the impact of cancer on body. Now let's move on to the next slide to see about the cancer treatment and its side effect in human body. Cancer treatments are designed to target and destroy cancer cells in the body. Cancer treatments such as chemotherapy, radiation therapy, immunotherapy, and so on. They have various side effects. It's important to note that not all patients will experience these side effects, and their severity can vary from person to person. Additionally, advancement in medical research and technology aim to minimize these side effects. Here are some common side effects I have listed out in this slide. They are associated with different cancer treatments. They are like nausea and vomiting, loss of appetite, constipation and diarrhea, mouth sores, ulcers, tiredness, fatigue, sore throat, dry mouth, difficulty in swallowing, and so on. These side effects lead to malnutrition, and malnutrition during treatment can lead to negative consequences such as increased risk of infections, treatment toxicity, increased healthcare costs, and decreased response to treatment. This will affect the quality of life and life expectancy also. Let us move on to the next slide to understand how to manage these side effects. Some tumors change the way the body uses certain nutrients. A patient may seem to be eating enough, but the body may not be able to absorb all the nutrients from the food. Cancer patients may have anorexia and cachexia at the same time. Here, I would request all our participants present here to note down these dietary tips I'm going to give for you for treating the side effects you might be facing, or you may be facing now, or you may face in the future. Loss of appetite. This can be treated by including spices such as cardamoms, cloves, and cinnamon in drinking water. Nausea and vomiting can be treated by simple ginger teas. Dry mouth can be treated by frequent sips of flavored water. Sores in the mouth or throat can be treated by consuming coconut milk in empty stomach regularly. Trouble swallowing. This can be treated by altering the consistency of the meal to semi-solid, soft, or full liquids. Feeling full after eating a small amount of food. This can be dealt by taking small, frequent meals. Constipation. There is a very good remedy for this. Regular consumption of 1 tablespoon of flax seeds post-dinner will surely help in constipation. Not only side effects management, comorbidities management is also very much essential. Comorbidity is 2 or more illness occurring in the same person. It includes any one or many of these such as diabetes, hypertension, chronic kidney or liver disease, obesity, and dyslipidemia. In addition to cancer diet, incorporation of restrictions for comorbidities will also help in better treatment outcome. Keep in mind, as I have already told, controlling the comorbidities is very much essential to control the cancer cell progression. External factors. Please note cooking method and cooking vessels also play an important role in nutrition. Most of us are confused about this because there are lots of different vessels available in the market. To be short, cooking in iron vessels adds on iron to the food and helps in improving the hemoglobin. Cooking foods in clay pots helps in changing the pH of the food, which is very much suitable for the human body and helps us live healthy. Cooking in stainless steel does not have any negative effect. Storing, when it comes to storing the food in glassware and ceramics are much better than using plastic containers. Cooking in aluminium, indolium, and non-stick will surely add toxins to the food and degrade the nutrients, making the food less in nutrition. So better avoid them. Also avoid regular consumption of pressure cooked foods. This will cause bloating and gastric issues. When it comes to cooking methods, boiling and steaming are the best in comparison to frying and grilling. Frying will add too much fat into the food, and grilling, because of grilling, there may be carcinogens produced in the diet. So these are all the challenges that lead to malnutrition, and subsequently the tolerance level towards the treatment may go down. Moving on to the final part, I would like to conclude here. It is simple as it is. Maintain a healthy body weight. Do regular physical activity to maintain healthy weight. Reduce your fat intake, particularly from animal sources, and avoid refined foods as they will increase the risk of cancer. Eat plenty of whole grains, fruits, and vegetables to meet antioxidant and fiber requirements. Avoid smoking and consumption of alcohol. Though there are so-called safer limits, studies still say that there are also reasons for increasing the risk of cancer. Keep in mind, food is thy medicine. Thank you all, and over to you, Aditi.
Thank you, Sharmila, for explaining the importance of managing well-being through proper diet during and post-cancer treatment so clearly.